Hello everyone and welcome back to the channel. Today in this video we'll be dealing the 10 MCQs in a very short period of time, maybe about 10 or 12 minutes. So from this very video I'm going to start this series with 10 questions in every video that will make your knowledge a more better. And today the topic that we are discussing is skin and vesicular bullous lesions. Okay, so it's a oral pathology topic, and this video is for those who are aspiring, who are NEET PG aspirant and looking forward for their further admissions in MDS. So this video is gonna useful for them. Okay, so skin and vesicular lesions, these are itself a very important topic and this need to be covered very thoroughly. So I'm going to do MCQs of this very topic from a very famous book, that is Pulse book. You might have heard of this name, as this is a very famous book which is being recommended by many institutions and people used to revise it a lot. Okay, so without wasting any time, let's start to this. The first question is, a flat circumscribed discoloration of skin or mucus that may vary in size and shape is referred to as. So the answer to this question is B option, that is macule. So why this option is macule? Because we have a number of lesions. We can say we have a number of variety. You have heard of the names macules, papules, plaques, vesicles, bullae. So macule is the very first one, which is well circumscribed, flat and inflamed or pigmented area. Next, if we talk about papule, papules are solid lesions which are less than 1 centimeter in diameter that are raised from the skin. These are not flat. They are basically found in erythema multiforme, rubella, etc. Third type is plaque. Plaque are large papules which are greater than 1 centimeter and they are raised. Now vesicles are a kind of blisters that contain fluid and these are less than 1 centimeter in diameter. Talking about bullae, so these are large vesicles, and last one is pustules which are containing purulent material. So this is a table that you will surely find in your textbooks, but according to the question number 1, the answer is macule because it is talking about flat. So from all of these, macules, papules, plaque, vesicle, bullae, pustules, also the options that are given to us, epulation, nodule, macule, papule, from all of this, only the macules are the one which are flat and well circumscribed. Now second question. A 21-year-old woman complains that regular gentle brushing of her teeth is painful besides causing profuse bleeding. Oral examination reveals a loss of epithelium from the attached gingival of both arches. Which of the following dermatological problems is this patient most likely to have? I have marked the important points in the question with my pencil, so you can see it's a 21-year-old female which on brushing have some painful as well as bleeding which occurs due to brushing, and on oral examination there is loss of epithelium, so we have to diagnose which dermatological problem is she suffering from. So the answer is first, that is benign mucous membrane pemphigoid. So let's see to the answers. It is, I have written the answers such like this, so you can also written like this because it will be easier for you. It's a 21-year-old female, brushing, painful, bleeding, oral examination, loss of epithelium and dermatological problem. So this is benign mucous membrane pemphigoid. You have to learn this, that if there is a kind of things like this in the question, then you must be having option of pemphigoid, and that pemphigoid must be benign mucous membrane. Next question is, which of the following is oral manifestation of lichen planus? So lichen planus की oral manifestation क्या होती है? The option, last option, that is D option, is right. White radiating lines of the buccal mucosa. So these are the white radiating lines on the buccal mucosa which are seen in the lichen planus. So this is the most common oral manifestation found. Next question is, anti-nuclear antibodies are seen in, question number 4, anti-nuclear antibodies are seen in So anti-nuclear antibodies are seen in SLE, that is option number A, and SLE is known as systemic lupus erythematosus. Systemic lupus erythematosus, that is fourth option. Fourth question, first option. Next is question number 5. Which of the following disease of skin is most likely to be associated with partial anodontia? So you must have been knowing what is anodontia. Anodontia is complete loss of the tooth in the oral cavity. And since it is partial anodontia, it means partial loss of tooth in the oral cavity. So following disease of skin is most likely to be associated. So if you see a partial anodontia in someone's mouth, which skin problem must be associated with it? And the answer is your ectodermal dysplasia. So the option is B. That is B option. That is your systemic hereditary ectodermal dysplasia. Hereditary ectodermal dysplasia is the most likely associated skin problem which is associated with partial anodontia. So what is ectodermal dysplasia? Now ectodermal dysplasia, it's a congenital disease, congenital dysplasia, which is prominently having three main things. If you ever come across such kind of questions, you should be having three things in your mind, that if there is ectodermal dysplasia, there will be three things. There will be hypohidrosis. Hypohidrosis means the sweat glands in the body that are absent, that is complete or partial absence of the sweat glands in the oral cavity. Hypotrichosis is the second thing, and third is hypodontia or partial anodontia. So there are three H that are related with ectodermal dysplasia. If another type of question can be asked, that what are the features of ectodermal dysplasia, then you should be knowing this. Next question is, which of the following is absent in CRUST syndrome, that is CREST syndrome? So if we look at to the answer, CRUST syndrome stands for C stands for calcinosis cutis, R stands for Raynaud's phenomena, E stands for esophageal dysfunction, S stands for sclerodactylity, and T stands for telangiectasia. So if we see to the question, if we see to the options, it is the D option which is incorrect, which is absent in CRUST syndrome, that is endocrine disorders. Now, seventh question, Nikolsky sign is positive in. So Nikolsky sign is very important question which usually comes in the paper. So what is Nikolsky sign? Nikolsky sign is the loss of epithelium occasioned by rubbing apparently unaffected skin. This is Nikolsky sign, and when there is apparent loss of the skin on rubbing, this is the positive is called Nikolsky sign. So in pemphigus, it is caused by prevesicular edema. In pemphigus, it is caused by prevesicular edema, which leads to the disruption of dermal epidermal junction. So that's why Nikolsky sign is positive in bullous pemphigus, because in pemphigus, due to prevesicular edema, dermal and epidermal junction disrupts. Next question is question number 8, that is Monro's abscess. It is also important question. What is Monro's abscess and where it is seen? So you can make a mnemonic of Monro's abscess. Monro's abscess, you can make a mnemonic of PRMG. P stands for psoriasis, R stands for Reiter syndrome, M stands for benign migratory glossitis, and G stands for geographic tongue. So in these four conditions, Monro's abscess is present. Now let's talk about question number 9. In lichen planus, basal cells which are shrunken with an eosinophilic cytoplasm and with a pycnotic and fragmented nuclei are. So in the lichen planus, there are a kind of cells which get shrunken with eosinophilic cytoplasm and they have a nucleus inside. These are called as cavate bodies. Now, seaweed bodies, also called as colloid bodies, also called as hyaline bodies, also called as fibrillar bodies. These are usually found in spinous and basal cell layer, and these are round eosinophilic granules. So this is all for today, and we have completed our questions and we have started a new chapter. I hope you liked the video. 10 questions in 10 minutes. Thank you.